Next up, we see the typical pharmacy billing cycle. Similar to the processing of a prescription, it starts out with the receipt of a prescription in some way. Next, you should ask the patient or whomever is dropping it off if there is insurance to bill and make sure it is accurate in the computer system. After entering the prescription into the computer, the claim is sent to the health plan and the patient's benefits are verified. This process is called adjudication. If the claim is approved and there are no other issues with the prescription that was input, the filling process can begin. Once it is filled and verified by the pharmacist, it can then be sold to the patient at the point of sale. The last few steps are typically not taken care of by the pharmacy staff. These steps are where accounts and payments are balanced and received from the health plan payers. The most common ways to receive a prescription these days are electronically, face-to-face, or by phone call. Just like with processing a prescription, all info should be verified for accuracy. If receiving a prescription via face-to-face, ask the patient or whomever is dropping it off if they have filled at the pharmacy before. If they answer yes, ask if there has been any insurance changes since the last time they filled. If they have not filled there before, ask to see their prescription insurance card and input it into the computer system. It is also acceptable to pull up a patient's profile in the computer with them still standing at the counter and attempt to verify any info at the same time. It is good customer service practice to keep patients in the loop about any issues regarding their insurance. Communicating any issues to them as soon as possible will help keep them as happy with your service as possible. If you encounter an error or a rejected claim when processing their prescription, try to call them back to the pharmacy if they are still in the store, or call them on their cell phone. As you gain more experience with prescription insurances and become more comfortable interpreting and fixing claims issues, it will become easier for you to communicate in an effective manner to patients about what is going on. Until you do become more comfortable with claims issues, it is perfectly acceptable to ask your fellow techs or a pharmacist for a second opinion about a claim. Unfortunately, patients can easily become disgruntled when insurance issues are left unresolved. However, communicating issues with them with empathy, a pleasant tone, and in a helpful manner will help alleviate this as much as possible.